Hello everyone, this is Anthony Chan. Today we're discussing the recent changes in terminology for a common liver condition. As you know, non-alcoholic fatty liver disease, or NAFLD, has been a widely used term. However, recent developments have led to a shift in nomenclature to reflect the underlying pathology better. Let's dive into what's changed and why. NAFLD is defined by the presence of hepatic steatosis after ruling out other causes of liver fat accumulation, such as significant alcohol consumption. The exclusionary nature of this definition, which hinges on the absence of significant alcohol consumption and other liver diseases, is a major limitation. While NAFLD is strongly associated with metabolic syndrome, which includes central obesity, hyperglycemia, dyslipidemia, and hypertension, the diagnosis of NAFLD does not require the presence of metabolic risk factors. Consequently, the current terminology and definition do not fully represent the underlying risks associated with the condition. Moreover, the terms non-alcoholic and fatty can have stigmatizing implications. The label non-alcoholic may inadvertently highlight alcohol consumption, potentially leading to unwarranted assumptions about a patient's lifestyle choices. Similarly, the term fatty might be perceived as pejorative, contributing to negative stereotypes and emotional distress for patients. In 2020, an international panel of experts proposed changing the terminology to metabolic-associated fatty liver disease (MAFLD). They also revised the diagnostic criteria for MAFLD to include hepatic steatosis combined with one of the following: overweight or obesity, type 2 diabetes mellitus, or signs of metabolic dysregulation in individuals who are lean or of normal weight. This change aims to emphasize the metabolic dysfunction driving the condition and move away from the exclusionary nature of NAFLD. Additionally, the panel suggested describing the disease process in MAFLD by the grade of activity and the stage of fibrosis, rather than using a simple classification of steatosis versus steatohepatitis. For lean or normal weight patients, evidence of metabolic dysregulation is defined as the presence of at least 2 metabolic risk abnormalities. Most recently, in 2023, 3 major multinational liver associations recommended replacing the term NAFLD with metabolic dysfunction-associated steatotic liver disease (MASL). They also proposed renaming non-alcoholic steatohepatitis to metabolic dysfunction-associated steatohepatitis (MASH). The new definition includes the presence of at least 1 of 5 cardiometabolic risk factors. This change aims to reflect the underlying pathophysiology better and remove the potentially stigmatizing terms non-alcoholic and fatty. The consensus was reached through an international, multi-society guided Delphi process involving a total of 236 panelists from 56 countries. In contrast to MAFLD, the definition of MASL includes cardiometabolic risk factors for both adult and pediatric patients. These new nomenclatures and definitions have been endorsed by more than 70 professional organizations. A full spectrum of steatotic liver diseases due to different etiologies has been proposed. Additionally, a new category called metabolic dysfunction and alcohol-associated liver disease (METALD) has been created for patients affected by both metabolic abnormalities and substantial alcohol intake. This diagram outlines the diagnostic approach we use to evaluate steatotic liver disease. With decades of clinical data and research findings available on NAFLD, a common question arises: can the existing NAFLD data be applied to the new MASL definition? My former colleagues at the Chinese University of Hong Kong re-examined their previous cohort of 1,016 healthy individuals who underwent proton magnetic resonance spectroscopy in Hong Kong. The population prevalence of hepatic steatosis was 27.3%. In this cohort, they found the prevalence of NAFLD-MAFLD and MASL to be 25.7%, 25.9%, and 26.7%, respectively. Among the 277 individuals with hepatic steatosis, 89.2% fulfilled the criteria for all 3 conditions NAFLD-MAFLD and MASL. Of the 261 patients with NAFLD, 5.4% did not meet the metabolic criteria for MAFLD, whereas only 2.3% did not meet the metabolic criteria for MASL. MASL has a closer overlap with NAFLD than with MAFLD. The minimal difference between MASL and NAFLD suggests that findings from older NAFLD studies are still valid under the new MASL definition. For pathologists, this is promising news, as the histological criteria for diagnosing steatosis and steatohepatitis stay the same. The progression from NAFLD to MAFLD and now to MASL demonstrates a better grasp of the metabolic factors behind steatotic liver diseases. This evolution helps reduce stigmatization while enhancing diagnostic accuracy and treatment options. Thank you for joining this discussion on the evolution of liver disease terminology. I hope you found it insightful for your practice and ongoing studies. Stay tuned for more updates on liver pathology. Don't forget to subscribe and leave your comments or questions below. See you next time.